Palm City families sorting through uncertainty, waiting on a decision that could change where their babies get care.
Yeah, we first connected with the family at a Let's Hear It. Brooke Chow listened to a concerned father about a letter he received warning that their insurance coverage could soon change.
They're making it, difficult for us to call this home. If, we're going to have to go elsewhere for medical care.
Brooke went from that conversation, really dug into the story. This morning, Brooke shares what's at stake.
Inside this Palm City home, life is full of toys, memories on the wall.
That's Reagan.
And twin baby girls, Cora and Reagan, who were adopted in April. Time moves quietly inside the Obanoff family living room. The waiting period began November 1st with an email parents Jessica and Tyler say they never expected. Florida Blue members may no longer be covered at Cleveland Clinic, one of the country's largest healthcare systems, come March 1st.
Jess, it's been 3 months since you got that email from Cleveland Clinic. If you were to just sum up the past 12 weeks with one word, what would that word be?
Disappointment. It's a bit of a slap in the face because we've had Florida Blue for years. I've always thought that was the premier insurance to have, that everyone accepts Florida Blue.
Their 9-month-old baby girl Cora was diagnosed with torticollis. Cora relies on Florida Blue insurance to cover physical therapy costs.
I don't want to fathom having to find another therapist.
If forced to change providers, care could move miles away, possibly across county lines.
If we do have to uproot and go physical therapy somewhere else, possibly have to drive to Jupiter, West Palm, Palm Beach Gardens, or all the way up to Fort Pierce, that's an additional strain.
The Obanoffs tell me the cost of stalled negotiations is landing on parents, not corporations.
They're the ones that can afford to shoulder that debt. We've shouldered enough.
As negotiations continue, this Palm City family is hoping time doesn't run out before answers come in.
Brooke joined to continue part of the conversation. Unfortunately, it's not just this family that's probably having many sleepless nights, worried about what's going to happen.
Right. So digging into the numbers here, Cleveland Clinic actually says more than 150,000 Florida Blue policyholders would be affected. But that word policyholders is tricky. These are real people. You think of that number, and then you have that Martin County family speaking out about this. So there's a lot of layers to this that we're going to continue digging into.
The reach is really wide here. My daughter had torticollis. We worked with a therapist. She really bonded through it. To have to switch the care midway through because your insurance drops you. It's a real concern. That's one health issue, right? But any health issue where you're dealing with a family member, a child, then maybe you have to switch care. It's daunting.
It is
for
daunting
parents to think about.
And real quick here, with the layers that I was telling you about, you have Cleveland Clinic saying the contract is through March 1st, but now you have Florida Blue coming out saying it's through May.
Yeah.
So regardless of the timeline here, the Obanoff family trying to get their voice out here and let them know about that critical care that their daughter needs.
There's a lot of bureaucratic red tape in all of this.
So what can you do? I did some research this morning, find out what Florida Blue policyholders who rely on Cleveland Clinic can do right now. Cleveland Clinic says to keep your appointments, ask about continuity of care, and call Florida Blue to request continued access at in-network rates.